Today on Champions of Care, we're providing information and advice about prostate cancer. With me is an expert, Dr. Surendra Kumar. Dr. Kumar, tell us, when someone gets that prostate cancer diagnosis, what do they do next? What are their options?
When first diagnosed with prostate cancer, a person needs to find out what the stage of the cancer is and what the grade of the cancer is, and that what determines what kind of treatment they may most benefit from.
The grade, how aggressive it is.
Correct. How aggressive the cancer is. They're generally divided into three groups: a low-risk group, an intermediate risk group, and a high-risk group. The treatment options, main treatment options for curative treatment for prostate cancer are either brachytherapy and radiation therapy from the outside or a radical prostatectomy. The differences between the two are in their cure rates and also in the complications that can occur after these treatments. For low-risk disease, it really does not make much difference in the cure rates. They respond equally well. However, there are major differences in the complications that patients might expect. With high-risk group and intermediate risk group, the treatment results from brachytherapy are distinctly superior to removing the prostate with the radical operation. And of course, the advantages of low complications with brachytherapy still are there.
So there are a lot of options, or at least a couple of options and choices that can be made between a patient and the physician to make sure they have the quality of life and the treatment plan that works best for them.
Yes, every time we see a patient, the treatment is always individualized to the given circumstances of a given person.
And you're an expert in some of those radiation options. Tell us about that.
Yes, the two major options for curative treatment for prostate cancer are either a radical prostatectomy, which involves removing the whole prostate with a major operation, and I guess our next speaker is going to talk about that in more detail. Mm-hmm. The other option is with radiation therapy. Radiation therapy can be given two ways. One is the treatment which is given from the outside, and it's called external beam radiation therapy, which runs for between 6 and 8 weeks with a treatment every day. The second option is to place the source of radiation right inside the prostate in the form of small metal seeds or metal pellets.
You have a picture of that
right.
Internal radiation, and it's called brachytherapy?
Right, we call that brachytherapy. It's derived from a Greek word. Brachy means closed, therapy means treatment, which means the source of radiation is placed right inside the prostate, very close to the tumor, so that it can act there and cure the cancer. And this is...
What are we looking at here?
This is a radiograph of a patient who had seed placement. This is done right after the procedure, and what it shows is the dark area is the bladder. This was done to get an X-ray. We injected some dye over there. And this is a catheter which is going right through the prostate and the urethral channel. And what you see, these small specks are what we call seeds. And what these are, they are composed of titanium capsules which are filled with a radioactive material, either palladium or iodine, depending upon what we had decided beforehand for a given person.
And those seeds do the job right close to the cancer, and by the time they've done their work, they are no longer radioactive, and I don't even have to have them removed. They can just stay in the body.
They stay in the body, and depending upon which radioactive material was placed, the radioactivity goes away within a few months.
Now, you're an expert in this therapy called brachytherapy, which is one of the breakthrough technologies for prostate cancer. Some people who've maybe heard it's not an option for them should give you a call, Dr. Kumar, and maybe it is. Is that correct?
Yes, it is. And the reason for that is in the last about 5-7 years, there have been major technical advances in the placement of these seeds and the understanding of the dose distribution within the prostate. And they have given us, now there are several studies through the country which has given us results of 10, 15 years follow-up with brachytherapy, which is giving treatment results or cure rates which are almost double of what you would expect from radical prostatectomies, for example. And this is particularly true for high-grade or high-risk disease patients.
And you're one of the national leaders in this. Our viewers can find out more about you and about brachytherapy by visiting your website at oakwood.org. Dr. Surendra Kumar, I want to thank you so much for being with us today on Champions of Care.
Thank you.
And when we return, we'll learn about some additional options, some surgical options, and we'll even hear how a robot may help treat prostate cancer. Stay tuned.